Minister, as you know, the Irish Nurses and Midwives Organisation have always invited the Minister for Health to our conference. We will continue to work with your department on issues which concern our members, aside from the current Croke Park issues and pay issues. The main dominating factors for our conference over the past 2 days have been patient care and patient safety. The nurses and midwives in this room and the nurses and midwives in hospitals throughout the country remain very concerned about frontline shortages. They have grave concerns about the quality of care being given to patients, and they have grave concerns about the lack of all frontline services. The conference has also felt very strongly, and I suppose it does lead into patient safety and patient quality on the graduate initiative. We feel that it is very important for our professions to protect its future by keeping our young graduates here where they belong, where we need their energy and enthusiasm. But Minister, I would like you to remember that all of us in this room, including you, have the safe care of every patient and citizen of this country in our hands, and that is what we want to protect. I would now like to ask you to address our conference.
Thank you very much, Madam President, General Secretary, members of the Executive, distinguished guests, delegates, fellow politicians. I know I met Deputy McHugh here. I want to thank you for your invitation to address you today, and indeed for your opening comments. I was going to say that I watched you coming up very carefully, because I didn't want to lose my footing on the steps. I'd like to start by saying that your profession is synonymous with commitment to excellence and education, to providing quality, safe care. But it's also synonymous with resilient response to new demands, and it always has been. The new demands made on you right now are enormous, and they're enormous for two reasons: the constraints forced on us by the economic downturn and the demands of reform. Either on its own would have been tough for you at the front line. Together, they're unprecedented, and have met with an unprecedented response at the front line. Nurses and midwives all day and all night, 365 days of the year, have demonstrated ongoing commitment to quality patient care and effective service delivery. The flexibility and dedication of health professionals means we're still delivering the same, and in many cases an enhanced level of service. And that's despite reduced financial resources and staff numbers. And although progress has been made in addressing the financial position of the state, the budgetary position remains challenging. This year, we are receiving €12 billion from the Troika. That's €1 billion every month. We have to continue to narrow the gap between the state's income and expenditure so that we can successfully exit the present bailout programme. For the public service, this means that government must pursue measures that are difficult, indeed more than difficult, for those who work in the service. For the HSE, pay savings of €150 million have to be achieved in 2013. On top of the many reforms and efficiencies designed to improve services and live within budget, pay savings must be made. Frankly, we're between a rock and a hard place. As you know, over the last few weeks, the Labour Relations Commission has been consulting with the public service unions to seek an agreed basis for making the savings needed in health and other parts of the public service. And I'm aware that your organisation has a team meeting a team from the Department and the HSE and the LRC as we speak. If we can find such an agreement, it will be so much better than an imposed solution. Those who depend on our health service must be able to rely on it, especially in times of great difficulty or personal crisis. I would ask your organisation to keep this imperative to the forefront in its deliberations, as I will in my departments. The Government remains committed to the most fundamental reform of our healthcare system since the foundation of the state. The next major step will be organising hospitals into a number of groups geared to integrate the way we deliver a wide range of services. The HSE is also finalising a new management structure. A key feature of these new arrangements will be the appointment of a Chief Financial Officer to establish robust financial governance structures and controls. The new governance legislation creating a directorate structure in place of the board should be enacted in the coming weeks. These changes will pave the way for the eventual abolition of the HSE and its replacement by new structures that will bring universal health insurance into being. A priority for the Government is to deliver faster, more equitable access to hospital services for patients. All we do must be focused on our patients and improving outcomes for them. And everybody in this room knows that the main complaint level at our health service by those who use it is not the wonderful care they get when they get inside the hospital, but the long wait to gain that access. Since 2011, with the support of the SDU and the clinical programmes, you have achieved significant improvements in waiting times for unscheduled care against the background of reduced funding and significant demographic pressures. By the end of 2012, for instance, there had been 20,000 fewer people on trolleys in Irish hospitals compared to the end of 2011. That's an improvement of 24%. And in 2013, despite the extended period of winter weather and a 3.5% increase in admissions from the emergency department, which included a 17% increase in the number of older patients admitted, up to the 19th of April we had a 7.7% fewer number of patients on trolleys compared to the same period last year. Comparing the first quarter of 2011 with the first quarter of 2013, the INMO figures show a 29% reduction in the number of patients who have to endure long trolley waits. These figures are a testament to the commitment and care you have delivered to patients in our hospitals, and I want to thank and acknowledge that. We have also addressed waiting lists for elective care. By the end of 2012, 98% fewer adults were waiting for over 9 months than at the same time in 2011. And for the first time, we have quantified to the full extent waiting times for outpatients, and we will deal with that change in the same way as we have dealt with inpatient waiting times. Once the urgent cases have been dealt with, the longest waiters will be seen first. Previous governments have swept this issue under the carpet. We have brought it to the full light of day so we can deal with it. The HSE's national clinical programmes are also continuing to create new ways to provide clinical care. Nursing and midwifery play a key role in the design and implementation of the programmes. To date, there are 35 lead clinical nurses and midwives for 25 programmes, and 10 programmes have a service planner on their working groups. Senior nurse and midwife managers are critical to the design, implementation and evaluation of the programmes and structures to enable this. Programmes such as acute medicine, not just saving bed days of over 121,000 to date, but changing behaviours. And saving bed days is not about saving money. It's about allowing more patients to be treated more quickly. The stroke programme, with its 24/7 thrombolysis, with coverage in the country for the first time across all our hospitals that receive stroke patients. This has resulted in one life a week being saved and 3 patients a week not having to go into long-term care. The early warning score, which has been rolled out across our adult services and now across our maternity services and being developed for our paediatric services. This, I know, will save lives. Other programmes such as palliative care, emergency medicine and diabetes are ongoing. All these initiatives are designed to improve patient safety, something I know is of major concern to everybody here, and I heard loud and clear your President's concern expressed as well. Many of you here today have been closely involved in the development and implementation of these reforms, and I want to thank you for your commitment to the ongoing improvement of our health service. Enormous benefits can be achieved through collaborative working between doctors, nurses and other healthcare professionals. The establishment of primary care teams throughout the country provides the basis for the delivery of integrated and more comprehensive health and personal care services in the community. Public health nurses and community registered general nurses are key members of these teams. Both Minister White and myself continue to work on the strategy to roll out universal primary care in Ireland, including examining innovative ways to accelerate access to GP care without fees. It is vital that as many services as possible are provided in the community. And just as nurses are the backbone of hospital care, so you must be the backbone of primary care. Nurses will continue to play a vital role in all services provided in the community. In addition, work is underway to develop diabetes services through the appointment of 17 clinical nurse specialists who will play a key role in the development of clinically sound collaborative links between primary and secondary care and will be an essential resource in empowering patients to achieve optimum diabetes control. I think we'd all agree that the more power patients have over their own health and their own care is to the good of us all. On the 28th of March, the Government launched Healthy Ireland, and this is a new national framework to improve health and well-being in Ireland. And it's a strong message from all of us who work in the health services to the rest of our community that yes, we're here to deal with ill health, but it's a cross-societal issue to improve the health of the nation, to ensure that people have healthy lifestyles and do not engage in habits that will be detrimental to their health overall. We want to seek to shift the emphasis in our health system from an illness model dependent on care in hospitals to a model where primary care services are strengthened and health and well-being are promoted. As each person at this conference is aware, organising and managing healthcare provision is a complex undertaking. As nurses and midwives, you work in, manage and direct highly complex environments and are accountable for a broad scope of responsibility and accountability for patient care, quality and staff satisfaction. Nursing and midwifery must play a real leadership role. This is particularly important in the current fiscally challenging environment and to achieve the government's reform agenda. Sometimes this can involve leading out on less than popular measures and challenging the orthodox analysis of issues in one's own and other groups. This is not a comfortable space to occupy, but these are the challenges that go with taking on real leadership roles. I know that a key priority of Dr. Michael Shannon, who's with us today, who's the Nursing and Midwifery Services Director of the HSE, is to provide leadership, support excellence and build capacity in nursing and midwifery. A number of important leadership development initiatives have been commenced. Examples of such initiatives from the National Leadership and Innovation Centre include the Future Nurse Leaders Programme for directors of nursing and midwifery to support them through this unparalleled time of reform and change. The Leading in Uncertain Times programme to support and strengthen the leadership contribution of staff nurses and midwives and clinical nurse and midwife managers. As clinical leaders, I would encourage you to nurture and grow the leadership and innovation capacity of yourself and your teams. Capacity and enhancing capacity is crucial. Continuous professional development provides exciting possibilities in this area. Nurses and midwives' skills, expertise and flexibility must continue to develop and expand into new and more autonomous roles in areas such as nurse-led patient discharge, chronic disease management, palliative care and nurse and midwife prescribing. The introduction of prescribing authority for nurses and midwives was a major milestone. A further development in this field is the programme of nurse prescribing of medical ionising radiation, X-ray. This is a further example of how nurses with ongoing education, training and development can really bring added value to our health services. To date, 159 nurses from 26 acute hospitals across the country have successfully completed the adult educational programmes for general nurses in independent prescribing of X-rays. Over 50,000 X-rays have been ordered by nurses, and this rate will increase as more nurses qualify. Nurse education in Ireland has a long tradition and is highly regarded, with an excellent reputation both nationally and internationally. I commissioned a review of the undergraduate degree programme for nursing and midwifery, and a report of this review was published in December 2012. This review identified that the nursing education programmes in Ireland provide for highly qualified, competent and well-motivated nurses and midwives. There was wide appreciation and acknowledgement of the benefits of degree-level education. Indeed, on this issue, discussions will continue to address your concerns regarding the graduate nursing programmes. Nursing and Midwifery Board of Ireland will be central to implementing many of the recommendations stemming from the report. This government is strongly committed to reforming our mental health services in line with the programme for government and a vision for change. And I am working hard with Minister Lynch to ensure that services are being refocused around the service user, mainly through more inpatient and community-based care, while enhancing quality of services and patient safety. The government's commitment has been underlined by the special allocation totalling 700 million for mental health in this year, comprising 35 million from 2012 and a further 35 million this year, to recruit up to 900 additional staff by the end of 2013. The allocation will be used largely to strengthen services such as community mental health teams across the full range of adult and child services. We have also prioritised addressing the tragic issue of suicide in our society, with a new focus currently being finalised for a range of prevention and support measures aimed at individual, family and community level. The government has increased the annual budget for suicide prevention this year to over €13 million. Within the last month, the National Positive Ageing Strategy has been published. It seeks to create a shift in mindset in how we conceptualise ageing and set out what needs to be done to promote positive ageing. In addition, work on the dementia strategy continues to be progressed. A public consultation process to inform the strategy has already been carried out, and we published a summary report of the consultation in February. I'm also pleased to confirm home help and home care package services have been preserved at levels planned for 2012. Can I just say, in finishing, that maintaining safe standards of care is at the centre of our approach to delivery of services. Managing clinical risk within constrained resources is challenging for all health professionals, but in particular for nurses and midwives. Excellence in nursing and midwifery care will continue to be a central pillar of our health system, and enhancing nursing and midwifery roles will help us achieve our central objectives, which are putting patients first and ensuring better outcomes for patients, providing quality, safe patient care and aftercare, and empowering frontline staff. Strong nursing and midwifery leadership must be at the heart of corporate and clinical governance structures in services. You must be centrally involved in service planning, budget control, management and clinical decision making. I have said on a number of occasions how important clinical leadership is to both our strategy for reform and our approach to improving services for patients. This is why when I established the SDU, the Special Delivery Unit, we ensured that it worked hand in glove with the clinical programmes. It's why we've invested in the Quality Improvement Programme for clinical leaders. It's why when we announced the hospital groups, we will require that every group has a Director of Nursing as a full executive on the management team with the Clinical Director and Chief Executive. I know the INMO shares this view of clinical leadership and has made a compelling case recently for the establishment of a Chief Nursing Officer within the Department of Health with higher status and a greater level of authority than has been the case in the past. This will provide strong national leadership for the profession, give a clear voice to nursing and midwifery as policy and strategy is being formed, and will lead essential national programmes on strategic workforce planning and a review of the present skill mix in hospitals, community and primary care settings. I am pleased to announce today that I will establish a new Chief Nursing Officer role within the Department of Health, that this role will be at Assistant Secretary level and a full member of the Management Advisory Committee, and will have executive authority to lead the nursing profession in Ireland and represent its perspective both to government and internationally. In short, the voice of nursing will be heard and listened to at the highest level of planning as the future of our health service evolves. Nurses and midwives are the bedrock of our health service, without whom services could not be provided right across the country every day of the year. I greatly appreciate the commitment and hard work that you bring to your role, and that the challenges we all face in recent years are without precedent in the recent history of the state. I hope that together we can successfully deliver the sort of care we all believe, as nurses and doctors, our patients deserve. I want to genuinely thank you all for the wonderful ethos of care and compassion that you bring every day to some of the most vulnerable people in our society. Thank you.
Minister, we've heard what you have said to us today, and we acknowledge that we do have differences, but we would also like to acknowledge and welcome a new Chief Nursing post. Minister, we don't want to delay you any further. We know you have a busy agenda, and so do we. But I would welcome the acknowledgement that the nurses and midwives here are under pressure every day they go to work. We have no problem with a collaborative approach to solving issues. We definitely have no problem with improvement in staff satisfaction. And we do hope that we will engage in discussions on the graduate issue. Thank you.
Stick to the day job.